Good morning, guys. We're all sparkly. Apologies for the lack of videos recently, but clinic has been incredibly busy and I've needed to concentrate on what? Work. But fundamentally, what's more important than work? Me. I've had to concentrate on self because if I'm not healthy, I can't give you guys the necessary tools and support and guidance to help you on your journeys. Now, when most people start TRT, they have an element of low mood, anxiety, depersonalization, fatigue, low libido. So they go, yes, testosterone replacement therapy. Now, I did a video, feeling worse before feeling better, that I often send to patients who struggle when they start testosterone replacement therapy, because there is a titration process and that change in physiology will cause a change in your psychology. And it's not always wonderful. Sometimes it can be slightly negative, but it is what it is. And anything negative is temporary. And we're always making incremental improvements to improve not only your numbers, but your sense of well-being by giving you a sense of perspective and realism that is lost. Now, I was speaking to one of my guys yesterday. He had his 11-week review and he was slightly despondent. He hadn't felt the changes that he was expecting from testosterone replacement therapy. Now, number one, he missed his 5-week review and it would have been addressed there. So when he was stable at 11 weeks, the conversation would have been very different, hopefully. Now, his levels were very respectable, but slightly low. So we bumped him up to make him optimal. So yeah, he hadn't seen the dramatic changes that he was expecting. Now, actually, the guys that see incremental improvements in their sense of well-being often do best, because your physiology does not actually want dramatic changes. This wants dramatic changes, but this doesn't. So what happens when you start TRT? Well, obviously you're replacing the hormones that are missing, testosterone, and as you guys know, we utilize HCG, which mimics luteinizing hormone. So we like to preserve testicular function and this, because there are LH receptors in the brain. So we see an improvement in your well-being and libido with HCG. So let's talk about this honeymoon period. What is the honeymoon period when you start TRT? Or make a change to your protocol? Well, it's the rise in your hormone levels. It's not rocket science, is it? But that rise in testosterone causes a rise in dopamine, the pleasure chemical, the reward chemical. That rise in estrogen causes a rise in serotonin, the happiness chemical. So you can realize that actually you are going to feel better as your levels increase, typically. And you want to feel like that all the time, because that's a nice feeling. But it's not realistic to expect that, because your levels are rising. And we want to what? Have stable levels. Stable levels for optimal physical and psychological well-being. But I want to feel good. Well, imagine what would happen if you woke up and felt amazing. Testosterone spikes in the morning because obviously your anabolic processes are working overnight to repair from the day before to prepare for the next day. Now, what would happen if your high testosterone and high cortisol made you feel amazing? You wouldn't do anything, would you? I feel amazing. Why am I going to go and hunt and gather? Well, I'm not going to, because I feel amazing. Where's my incentive? There is no incentive. So what should testosterone do? Testosterone should give you the drive and determination, the motivation to go and seek what? Yeah, desperately seeking dopamine. So Testosterone is not supposed to make you feel amazing. It's supposed to give you the drive and determination to seek the amazing feeling that you want. Now, how you do that is entirely up to you. But as I've said many times before, we are physical beings in a world full of psychological stress. So we should be aspiring to achieve our reward through effort. And as you guys know, when you've got low testosterone, you do not see the reward for your effort. So with normal testosterone, not high testosterone, normal testosterone, you should see the reward for your effort. Now, this guy yesterday was a past anabolic steroid user. And so when we counsel these guys, we do have to tell them you are not going to feel how you felt on anabolic steroids. Now, lots of people, paradoxically, don't feel amazing on anabolic steroids. High testosterone, high dopamine, high estrogen, high serotonin. What's he talking about? Disappointingly, you do not always feel good on anabolic steroids. Disappointingly, that's not the right word, is it? But because ultimately you get downregulation and you get a distortion of what? Your perspective and your reality. Now, you can feel amazing, but it is a distortion and it's not sustainable. Now, there's a reason why people do anabolic steroids for 12-week cycles, because even the bozos realize that that dysregulation of your physiology is not sustainable. We've spoken about the risks of high testosterone before, and obviously the fundamental one is psychological dysregulation, cardiovascular dysregulation, boobies, all sorts of things. So we want to be normal. We want to have the ability to experience highs and lows, contrast, yin and yang, motherfuckers. Okay? Anabolic versus catabolic, sympathetic versus parasympathetic. I've said this numerous times before. Consciousness is the is a subjective appreciation of subtle changes in physiology. So these guys who have felt amazing on anabolic steroids want that feeling back. It ain't going to happen because it can't happen. So you have to manage their expectations and you have to give them a sense of realism. As I've said before, you should feel motivated and driven on testosterone replacement therapy to go earn your reward. So it's very different when you're comparing anabolic steroids with other illicit recreational drugs, which people realize are bad for you. Big high, long low. With anabolic steroids, your sense of perspective is distorted because you take them for a long time. So your brain resets and goes, well, okay, this is normality. It's not normality. Normality is experiencing highs and appreciating the highs and experiencing lows and hopefully learning from the lows so that you don't go through the same subjective experience. Physiology is incredibly complicated. We want to make it incredibly simple for you. So keep it simple, keep it safe. Microdosing testosterone, cypionate and HCG is the most effective way of achieving stable male androgen levels. And as you guys know, that daily injection allows for a very subtle peak, which does what? Yeah, gives you the peak that you would have naturally within your system. So we want to closely replicate, mimic physiology to allow you to do what? Yeah, earn your reward.